Hello everyone. In today's class, we would be studying the neck further. You've already studied the posterior lateral part of the neck when you looked at the posterior triangle. You've also had a class on the deep cervical fascia in which you understood the placement of structures in the neck. Now, just to revise that placement of structures, to recap the placement of structures, you know that anteriorly, in the anterior part of the neck is present the trachea, and posterior to it is the esophagus, and this we are talking at C6 level. Flanking the trachea on both the sides are the lobes of the thyroid gland, and at some level we may also see the isthmus of the thyroid gland. Now, anterior laterally are present the neurovascular structures which are running in the neck as a toto. Then the branches are going all over and spreading all over the neck. So anterior laterally are the main neurovascular structures. All these structures are wrapped by muscles. Posterior laterally, as well as posteriorly are the muscles of the neck, which are supporting the neck. So these are the structures, the scalenes and the nerves, the the brachial plexus branches, as well as branches of the cervical plexus are the structures which you saw in the posterior triangle. Right? We still have to do this posterior part of the neck when we will be doing the suboccipital triangle. But presently our focus is on this anterior part. Now you can see that this area is again wrapped by muscles. It is protected by the sternocleidomastoid and these group of the infrahyoid muscles in the lower part of the neck. In the most superior part of the neck, these muscles, they may be either continuations of the infrahyoid muscles or the suprahyoid muscles may come into the picture. So the next two lectures are going to focus on these visceral structures which are wrapped by and the muscles which are wrapping it. So the anterior part of the neck has more of the visceral structures, while the posterior part of the neck and the posterior triangle had the muscular structures which we've already seen. So the competencies which we will be covering are: describe the boundaries and subdivisions of the anterior triangle, describe and demonstrate boundaries and contents of muscular and submental triangles, which we are going to complete. And we will also start with the carotid and the digastric triangles. Now, don't let these two, just that they are just two competencies, fool you, because this is a lots of structures are going to come into it, again, like they have been appearing in head and neck so far. There are multiple structures which you are going to see, and please pay attention so that when you come to us and you look at these structures in the dissection hall, it is easier. So why is it important? So let's start with a case scenario. Now this gentleman who's not King Joffrey or Prince Joffrey in this particular scenario, goes for a birthday party where he eats something. He's having a good time. He eats something and all of a sudden he collapses. He is rushed to the hospital by his friends, and you notice the intern on duty. The intern on duty notices that his lips are swollen. He has a generalized rash on the body. The lips, the tongue, the uvula are swollen. You can hear a wheeze and a stridor. That is, he's having difficulty in breathing. He's obviously collapsed, so his blood pressure is low. His SpO2 is 88, and he requires an immediate tracheostomy. So what are the structures which you will encounter when you perform a tracheostomy are the basis of this particular part of the lecture. Now let's start by drawing the boundaries of the anterior triangle. And then first we'll draw of the neck, demarcate the anterior triangle, and then further subdivide it. Now the neck, as you know, extends in its superior direction from the external occipital protuberance, the superior nuchal line, the mastoid process. So let's go from the mastoid process. The mastoid process. Then in front of the mastoid process is the auricle. So we'll just have the auricle out here. And in front of the auricle, let's draw the mandible with its inferior angle, the ramus with its inferior angle, and here we are drawing the body of the mandible. Now, there is an imaginary line for the subdivision of neck. We draw an imaginary line from the mastoid to the inferior angle of the mandible. So the superior limit of the neck is from the external occipital protuberance, the superior nuchal lines, the apex of the mastoid process, the imaginary line which is joining the mastoid process to the inferior angle of the mandible. Then we have the inferior border of the mandible. Inferiorly, it is bounded by the clavicle and the manubrium. Then posteriorly, we've also seen that there is a muscle, the trapezius, with its extensive origin as well as insertion. One of its points of insertion is in the posterior border of the lateral 1/3 of the clavicle, which is visible to us out here. Right? The anterior limit of the neck is an imaginary line of the side of the neck, this quadrilateral which we are making. Is because the neck is bilaterally symmetrical. The anterior limit is by an imaginary line which extends from the chin to the manubrium. Now, bisecting this quadrilateral area which we've just demarcated is the sternocleidomastoid, which you've already seen in your class of posterior triangle, has one point of attachment to the mastoid process, and the other is to the superior surface of the medial third of the clavicle by means of the clavicular head, and a sternal head which goes to the anterior surface of the manubrium. Right? So we have the two heads which are giving it attachment. The sternocleidomastoid divides the neck into two triangles, the posterior triangle and the anterior triangle. Now, important framework in the anterior triangle. There is an important skeletal framework which is present in the anterior triangle of the neck, which is formed by the hyoid bone, which is a U-shaped bone, has a body, a lesser cornu, and a greater cornu. Right? It is suspended in the neck by means of a stylohyoid ligament, which extends from the styloid process all the way to the lesser cornu of the hyoid bone. Plus, it has other muscles which are suspending it into the neck. These are the muscles, the suprahyoid muscles, the infrahyoid muscles, these muscles of the tongue. They're all suspending it in the neck. It has no bony articulations. Now, inferior to the hyoid bone is the thyrohyoid membrane. Then is the cartilages which are forming the larynx. This is the thyroid cartilage. Then would be the cricoid cartilage, which is behind this muscle which you are seeing. Then we have the tracheal rings which are coming in. Right? So this is the structures which are present out here in the neck. I'm not going to draw all of these. I'm just going to focus on the hyoid bone. But you have to always remember that in the base are present this structure. So make that picture in your head about these structures being present out here in the neck. So let's draw the hyoid bone, the body of the hyoid bone, the greater cornu, the lesser cornu, and this is the greater cornu which we draw. Now, attached to this is an important muscle, which is the digastric muscle. The digastric muscle has two bellies, an anterior belly, and this is the posterior belly. The anterior belly of digastric, the posterior belly. It has an attachment. The posterior belly arises from the medial surface of the mastoid process. So अगर यहाँ sternocleidomastoid यहाँ पर attached था तो उसके ये lateral surface है. तो medial surface of this mastoid process पर एक notch है, which is nearer to the temporal bone, the mastoid notch. From the mastoid notch arises the posterior belly of digastric. It traverses the area of the neck, right? Comes to the hyoid bone, where it is attached at the junction of the body and the greater cornu by means of a sling, right? Just like the sling you saw with the omohyoid. It changes its direction out here. So it does not gain any attachment, but it goes into the sling, then changes its direction and becomes the anterior belly, which attaches to the digastric fossa, which is present on the inner surface of the mandible. So this muscle is the digastric muscle with its two bellies, an anterior smaller belly and a posterior larger belly. The posterior belly is supplied by the facial nerve. Remember, the facial nerve came out from the stylomastoid foramen. So it gives it gave the branch to the posterior belly of digastric. The anterior belly is supplied by a branch from the mandibular nerve, which is उसकी subdivision है inferior alveolar nerve, जिसकी subdivision है mylohyoid nerve, which is supplying this anterior belly of digastric because it's lying over the mylohyoid muscle, which we'll see in some time. Right? Now, what is their action? It depresses the chin. It depresses the chin when it acts in this direction and retracts the hyoid bone. So, the direction of action would be this, depresses the mandible and retracts the hyoid bone. Now, this action is important during swallowing as well as when we are speaking, phonation. We will see that in detail in some time. Now look at the other muscle which is present here, the stylohyoid muscle, which also I need in a few minutes, so we'll just finish that also. From the surface, from the base, posterior surface of the styloid process, this is the styloid process, arises a muscle which is the stylohyoid muscle, which runs parallelly with the posterior belly of digastric and inserts at the junction of the body and the greater horn of the hyoid bone. By dividing, at its insertion, it divides into two, it forks out, and in between the two prongs of the fork moves the intermediate tendon of the digastric muscle. Can you see that? So this is an important thing to remember when we are talking about these muscles. Again, when the stylohyoid muscle will contract, it will retract the hyoid bone. All these are suprahyoid muscles. They are present above the hyoid bone. So let's draw in the posterior belly of digastric. So this would be the posterior belly of digastric, which would be coming in this direction. And then it's going to change its direction out here and form the anterior belly. Right? So यहाँ पर we have this intermediate tendon. Now, the other important muscle which we need is this muscle, which is the omohyoid. You've already again seen this in the posterior triangle. So it has its attachment again at the place on the hyoid bone. This is its superior belly, and then it forms an intermediate tendon which is attached to the clavicle by a sling of clavipectoral fascia, and then we have the inferior belly of omohyoid, which was going towards the scapula, towards the suprascapular notch. Now this is the next muscle. Let's put in this muscle also. So here, I'm sorry, let's make it more laterally. Here would be the superior belly of omohyoid, and then we have the inferior belly, which would be moving in, and here would be the intermediate tendon. Now, in this way, now let's divide the anterior triangle into the subdivisions. Now, between the anterior medial line, anteriorly, the posterior inferior border, which is formed by the sternocleidomastoid, and the superior belly of omohyoid, this triangle which is formed is known as the muscular triangle. Between, again, the superior belly of omohyoid, which is present anteriorly, the posterior belly of digastric, and the anterior border of sternocleidomastoid, this triangle is the carotid triangle. So the infrahyoid region is divided by the superior belly of omohyoid into a muscular triangle and a carotid triangle. Now the suprahyoid region, that is above the hyoid bone. Now look at that. In between the body of the hyoid bone, again, in between the body of the hyoid bone, the anterior belly of the digastric and the anterior median fissure, this area is the submental triangle, that is below the chin. And the base of the mandible, between the inferior border of the mandible the anterior belly of digastric and the posterior belly of digastric. This area is the digastric triangle. So we have subdivided our triangles by using two important muscles, which are the the digastric with its posterior belly as well as anterior belly, and the omohyoid, superior belly of omohyoid. The anterior triangle has further got divided into its four subparts. Now, although we are making these subparts of triangles, please remember that structures are going to transgress these boundaries. They're going to move from one boundary to the other. It's just for us, for our understanding of placement of structures, and sometimes when we see pathologies in the area, to know what would be the underlying structures. This is all for that. Otherwise, structures will move freely from one triangle to the other. Some may remain, but some may move freely. For example, the vessels, the blood vessels, the nerves are going to transgress one triangle to the other triangle. Now the skin which is covering the neck has tension lines which run transversely, and as you know, incisions along these lines tend to heal with minimal scarring. Now, the cutaneous nerves, there are a large number of cutaneous nerves and vessels out here, and these cutaneous vessels are especially important because you will be, when you go on further in your in surgery, you will see various skin flaps being picked up from the skin of the neck because of its extensive vascularity. Now, the nerves which are going to be supplying this are these cutaneous nerves which you saw in the posterior triangle. Of importance are this great auricular nerve. Okay, now let's do all of them. This is the accessory nerve. The accessory nerve, you know, moves from the sternocleidomastoid towards the trapezius. It's moving transversely through this area of the posterior triangle. Now, winding around it is the first nerve, which is the lesser occipital, which is going all the way to the scalp and supplying all the areas, the area posterior to the auricle, some part of the auricle, as well as the scalp. This is the lesser occipital nerve. Then running parallel to this external jugular vein is this great auricular nerve, which is going towards which will supply the auricle as well as the skin over the parotid and some of the skin of the anterior triangle. This is very important with the area which it supplies over the parotid, which we saw in the Fraze syndrome. Then running deep to the external jugular vein and reaching the anterior part of the neck by traversing the sternocleidomastoid is this transverse cervical nerve, which is going to be supplying a majority by dividing into its anterior and posterior branches. It's going to be supplying the skin of the majority of the part of the neck. It is also going to get some reinforcements from the cervical branch of the facial nerve, which is going to enter into the neck, as well as from this medial supraclavicular nerve. So these are the supraclavicular nerves. Together, they are going to be supplying the cutaneous structures, the cutaneous sensory nerve supply to the neck. The veins. Now, the superficial veins of the neck are very important. If you remember, you saw these nerves peeping out when we were performing tracheostomy on that patient. So this is the anterior jugular vein, which starts from the small unnamed, which is inconsistent, variable in its position. So that's a problem when we are doing surgeries in this area. It starts from these small veins which join together to form this anterior jugular vein. There are two of them running parallel to each other on both sides of the midline. They pierce the deep cervical fascia somewhere about an inch above the mandibulosternal joint. Then it moves laterally and enters into the external jugular vein. And with the external jugular vein, it enters into the subclavian vein. Now, if you remember, the external jugular vein was formed from the posterior division of the retromandibular vein joining the posterior auricular vein. The posterior division of the retromandibular vein along with the posterior auricular vein join together to form this external jugular vein, which also pierces the deep fascia, receives the anterior jugular vein, also the transverse cervical and the suprascapular veins, and together they enter into the subclavian veins. Now, the next structure which is present underneath the skin in the subcutaneous tissue is this muscle, the platysma. This is going to be forming the roof of most of our triangles except of the muscular triangle, because as you can see in the anterior part, it is not present. Now the muscle, the platysma, is a rhomboidal shaped muscle which arises from the fascia which is covering the pectoralis major and the deltoid muscles. Ascends upwards. It goes, most of its fibers attach to the lower border of the mandible. Some ascend further and interlace with the muscles of the lower lip. Some of the fibers also interlace with the muscle fibers of the opposite side. In this dissection picture, again you can see that when the skin has been removed, this is the platysma muscle. It is going to be supplied by the cervical branch of the facial nerve. Remember the fifth branch of the facial nerve which we saw in the parotid region. The fifth branch is the cervical branch which is going to be supplying the platysma muscle. So how does it act? It acts, number one, by pulling down these muscles, the depressor muscles of the lower lip with which it interlaces. So it's going to pull down these muscles, number one, and thus bring in the expression of horror or disgust, which we may sometimes show. At the same time, it decreases the concavity which is present in the neck, thus taking off the pressure which is present on the veins sometimes by making it contract, we can bring about an anti-sphincteric action. The paralysis causes the muscle to sag, the skin to sag over here, and whenever this muscle is incised for whatever reason, it is important that it is sutured, because otherwise in lacerations the wounds tend to gape. Also, one more thing, kindly note that the anterior triangle, the lower part of the anterior triangle is not covered by the platysma, but the posterior triangle is completely covered by the platysma muscle. Now let's come to the triangles which we are going to discuss today. The submental triangle and the muscular triangle are the two triangles which we are going to study in detail. Again, you can see the skeletal framework which is formed by the bones, which is the hyoid bone, and the cartilages of the larynx as well as the cartilages of the trachea. This is what is there. I would want you to palpate all these structures in you. So depress your chin to loosen the deep cervical fascia. Now put your fingers on the chin, then go further deep. You'll be able to feel the hyoid bone. Now, the symphysis mentae as well as the hyoid bone lie at the level of C3 cervical vertebra. Thereafter is the thyrohyoid membrane, which you can't feel. Then you can feel the upper border of the thyroid cartilage. This is the superior border of the thyroid cartilage, which is at the level of C4. Thereafter, further go on below, you'll be able to feel the cricoid cartilage, and there in the suprasternal area, you'll be feeling for these the tracheal cartilages. So these are the structures which are present in the midline, and इनको हम protect करने वाले हैं, and इनके ऊपर हम muscles place करने वाले हैं. So the first area which we are going to study is the submental triangle. Now, there is only one single submental triangle which is formed by the two anterior bellies of digastric on both the sides. So, this anterior belly of digastric on this side and this anterior belly of digastric on this side, with its tip at the chin and the base at the body of the hyoid bone. Together, this area is the first triangle which we are doing, which is the submental triangle. It's a single triangle. Its boundaries are the anterior belly of digastrics on both the sides, the body of hyoid bone, which forms its base. The apex is at the chin or the symphysis mentae. The floor of the triangle, this area, is formed by the mylohyoid muscle. Now, the mylohyoid muscle is like the diaphragm. It is separating two important regions, that is, the neck from the oral cavity. So, both sides of the mylohyoid together form a diaphragma oris, which is going to be separating the oral cavity from the neck. Now, how is it attached? This is, in this picture, you can see the internal surface of the mandible. Now, from this area was the digastric fossa, right? यहाँ पर हमने anterior belly of digastric को insert करा था. Now, from here, going all the way up till the third molar tooth, there is, sorry, this is not the orientation, I'm sorry. This way. These are the mylohyoid lines. So, if you look at this, this is the mylohyoid line. which is present on the internal surface of the body of the mandible. And attached to it is the mylohyoid muscle. So it divides, the mylohyoid muscle divides this internal surface into two areas, a sublingual area and a submandibular fossa. This is the oral cavity. इसके ऊपर और ये जो नीचे वाली ये हम neck में ले रहे हैं. So the mylohyoid muscle is attached to the mylohyoid line. Then the fibers which come out, with the fibers which are radiating out, most of it, anterior 3/4 of these fibers form a fibrous raphe with the fibers of its opposite side. So this is the fibrous raphe which is formed by the fibers with its fibers of the opposite side. And 1/4, posterior 1/4 of it gets attached to the body of the hyoid bone. So this is the mylohyoid muscle. Obviously, when it contracts, what is it going to do? When it contracts, it elevates the floor of the mouth. It can elevate the floor of the mouth, elevate the hyoid bone, and thus help in the first stage of swallowing. When it can also, on the other side, if it contracts on the other side, it's going to depress the mandible. The mylohyoid muscle, along with the anterior belly of digastric, is supplied by the mylohyoid nerve, which is a branch of the inferior alveolar nerve. Now, again, the boundaries of the submental triangle was one. The floor is formed by the mylohyoid muscle. The apex is the symphysis mentae. The two sides are formed by the anterior belly of digastric, and the base is formed by the body of the hyoid bone. What are the contents of the submental triangle? Present in the submental triangle are there are going to be some submental lymph nodes. These lymph nodes are going to drain this area, the area of the chin, all the area which is present out here of the chin, as well as the tip of the tongue. And starting here are the small veins which unite together to form the anterior jugular vein. Right? So what have we done? We've covered this area which was present between the body of the hyoid, this body of the hyoid, which is the hyoid bone, as well as and the mandible. हम covering करना शुरू कर रहे हैं. तो हमने इसके ऊपर पहले mylohyoid muscle लगाए, and then over that we placed in the anterior belly of digastric. So the superficial structure would be, after we've removed the skin, the superficial fascia, we would first encounter the anterior belly of digastric, and then we would come across deeper to it the mylohyoid, and deep to it now we know is the oral cavity which is going to be present. So the muscles of the tongue are going to come into the picture. Now, after the suprahyoid region, let's go on to the infrahyoid region. Now, again, the skeletal framework or the cartilaginous framework which is there, this is the thyroid cartilage. Now, on the thyroid cartilage is this line which is of importance to us, the oblique line, which is running obliquely on the lamina of the thyroid cartilage. This is the superior border of the thyroid cartilage, which is at C4. It meets its opposite and forms the laryngeal prominence, or what is also known as the Adam's apple. This is the inferior border of the thyroid cartilage. Here would be a cricothyroid joint. This is the cricoid cartilage, which is at the level C6, and then the tracheal rings. Now, here, what is happening on this is what we are going to see in the next area, that is the infrahyoid region, in which we are going to see the muscular triangle. After the this deep cervical fascia is removed and the sternocleidomastoid is retracted a little bit, thereafter we can see the muscular triangle. This is bounded by anteriorly by the anterior median line or the imaginary line, which is now running from the body of the hyoid bone to the sternum, that part of it. Posterior superiorly, it is bounded by the anterior border of the superior belly of the omohyoid. So superiorly, it is bounded by the omohyoid, and inferior posteriorly or posterior inferiorly, it is bounded by the anterior body of the sternocleidomastoid. So this area This area is the muscular triangle of one side, right? Now, this is the muscular triangle of the one side, and that would be the of one side. And in this, we are going to see the muscles. Now, there are two ways of looking at these muscles. Some people say that these are the contents. These muscles, which are known as the strap muscles, are the contents of the muscular triangle, while the others view it that they form the floor of the muscular triangle. Either way, it does not make a difference. We have to talk about the muscles, which are called the strap muscles, because they are parallelly running ribbon-like muscles, which are present between the hyoid bone, the sternum, the clavicle, and the scapula. Now they are arranged in two layers. Number one, superficial layer is made by the sternohyoid muscle and the superior belly of omohyoid. Do you remember the sternohyoid and the sternothyroid muscles? You saw them when we were doing the attachments on the sternum. They were attached to the manubrium on its inner surface, the internal surface of the manubrium. These were the two attachments, the sternohyoid, and this was the attachment of the sternothyroid. Now it is these muscles which we are now talking about. So the superficial layer of the strap muscles is formed by the sternohyoid and the superior belly of omohyoid. Once we remove them, then the deeper muscles come into picture. These are the sternothyroid and the thyrohyoid. The names tell you their attachments, that is from what structure to the other they are moving. So let's come on to the superficial layer, the sternohyoid muscle. Arising from the posterior surface of the manubrium, the adjoining sternoclavicular joint and the posterior aspect of the clavicle is the sternohyoid muscle, which ascends all the way up to the body of the hyoid. It is a midline structure, but as it's moving upwards, you can see it's converging, but it separates a little bit to bring the laryngeal prominence into the picture. So it goes on both the sides. The muscle of one side and that of the other side goes on both the sides of this laryngeal prominence or the Adam's apple. Present lateral to it and side by side is the superior belly of omohyoid, which attaches to the body of the hyoid bone more laterally. It descends downwards, forms an intermediate tendon, which is attached to the clavicle by the means of clavipectoral fascia. It is lying anterior to the structures, the neurovascular structures which are present in the neck. Thereafter, it forms the inferior belly, which is running all the way to the suprascapular notch as well as the transverse scapular ligament, which attaches to the superior border of the scapula there. This inferior belly divides the posterior triangle, which would be here, into a supraclavicular triangle as well as the omohyoid triangle above, or the occipital triangle above. Right? So here we are bothered here by the superior belly of omohyoid, which is present, which is a strap muscle, which is present in the muscular triangle area. Once we remove these muscles, then the next two muscles come into the picture. The sternohyoid muscle, which is attached to the manubrium below and ascends upwards to attach to the oblique line of the thyroid cartilage. Remember, we just saw this line on the thyroid cartilage, which is known as the oblique line of the thyroid cartilage. And starting from the oblique line of the thyroid cartilage and moving towards the greater cornu of the hyoid bone is the next muscle, which is the thyrohyoid muscle. Now let's discuss the action of these muscles, or the strap muscles or the infrahyoid muscles, which we just saw. Number one, look at it. They are anchoring the hyoid bone to what all structures? To the manubrium, to the clavicle, as well as to the scapula. So their first function is that they are anchoring the hyoid bone. The stabilization of the hyoid bone and in turn the larynx is very essential, because thereafter only the suprahyoid muscles the elevation and the depression can take place when we are talking or when we are swallowing. All these actions are a play of the suprahyoid and the infrahyoid muscle. Now they also tend to depress together the sternohyoid, the omohyoid, as well as the sternothyroid. They can depress the hyoid bone and the larynx, which is essential again during swallowing and speaking. So once they depress all these structures, hyoid bone and the larynx. as well as they stabilize these bones. So in this picture, you can see how the action is taking place, how the depression of the larynx as well as the depression of the hyoid bone is taking. The elevation of the hyoid bone can also be brought about by the thyrohyoid. Mostly it depresses, but the other side action can also take place. So this is the action of the muscles which are forming whatever you want to call are the contents of the muscular triangle or are forming the floor of the uh, muscular triangle. Now let's talk about how the innervation to these infrahyoid muscles comes from. So to supply these muscles and some other muscles of the neck, we have what is called the cervical plexus. Now, you've already seen certain muscles. You've seen the sternocleidomastoid and the trapezius, which was supplied by a cranial nerve, which is the axis V nerve. But you also saw the scalenus medius, the levator scapulae, and these muscles which we are going to talk about, these strap muscles. These are going to be supplied by the cervical plexus. So it's a plexus of nerves which is formed from the ventral rami, which is formed by the ventral rami of cervical nerves C1 to C4. As you're already aware, C5 onwards, they go on to form the brachial plexus. So in line with the brachial plexus, the formation of the brachial plexus are these cervical ventral rami of cervical nerve C1 to C4, which will be forming the cervical plexus. इनके dorsal rami भी आप देख चुके हैं. You've seen the dorsal rami of C2, which formed the great occipital nerve, which you saw in the greater occipital nerve, which you saw in the scalp. Then you've also seen the lesser occipital nerve, which is the dorsal rami of C3. The dorsal rami of C1 we will be seeing later when we talk about the suboccipital triangle. Presently, we will focus on the ventral rami. Now, where is the cervical plexus located vis-a-vis its situation in the neck? So when we look at the neck, if you draw an imaginary line from the root of your auricle all the way down up till the upper border of thyroid cartilage, in this line would be present the ventral rami of C1 to C4 forming the cervical plexus. They will be lying posterior to the internal jugular vein as well as the sternocleidomastoid and anterior to the scalenus medius and levator scapulae muscles. Okay, so we are now going into that area. Again, we've come to the lateral side of the neck, and we are doing in the we are dissecting or we are working in the area which includes the anterior triangle as well as the posterior triangle. So anterior to the scalenus medius and levator scapulae, posterior to the sternocleidomastoid, and posterior to the internal jugular vein. Deep to this vein, the internal jugular vein, is going to be present the cervical plexus, which is from the ventral rami of C1, C2, C3 as well as C4. Now let's draw. Now there are lots of diagrams which are available in many books, but I've taken the simplest diagram of all. It may, but this is the simplest thing to understand and to follow and draw if we ever have to draw this diagram. So the ventral rami, let's draw the ventral rami. Let's draw the ventral rami of C1, C2, C3, and C4. C1, C2, C3, as well as C4. Now the ventral rami of C2 sends a branch, an ascending branch, which joins the C1. The C1 fibers hitchhike along a nerve, which is a cranial nerve and exiting through the cranial base. This is the hypoglossal nerve, which you know is the 12th cranial nerve, which exits out from the hypoglossal canal, the 12th cranial nerve. The C1 fibers hitchhike with the hypoglossal nerve for some time, and then some of the fibers exit out as the superior root of Ansa cervicalis. The superior root of Ansa. The remaining fibers run along with the 12th cranial nerve and end by supplying the two muscles, the thyrohyoid, which was the strap muscle which was moving from the oblique line towards the greater cornu of the towards the greater horn of the hyoid bone, and the geniohyoid muscle. Right? Now, some fibers from C2 move backwards and form the cutaneous nerve, the lesser occipital nerve, which goes on to supply the posterior aspect of the nape of the neck as well as the posterior inferior aspect of the scalp. Fibers from C2 join with some fibers of C3 and together they form another cutaneous nerve, which again you've seen in the posterior triangle, the great auricular nerve, which supplies the skin over the mandible, the angle of the mandible, as well as the parotid. Some fibers of C2 join with fibers of C3 to form the transverse cervical nerve, which moves anteriorly to supply the anterior part of the skin of the neck. The C2 and C3 fibers also join together. The C2 and C3 fibers also join together and form this inferior root of the Ansa Cervicalis. Together, the superior root and the inferior root join together to form the Ansa Cervicalis, which will be supplying the strap muscles, the infrahyoid muscles. Now, fibers from C3, C4 join with some fibers of C5 and form the phrenic nerve. Fibers from C3 and C4 also run along the accessory nerve and also from C2 to give rise to proprioceptive fibers to the sternocleidomastoid and trapezius. Fibers from C3 and C4 also join together to form the supraclavicular nerves. So the cervical plexus, oh no, one more. They also supply the prevertebral group of muscles, which would be lying out here, anterior to the vertebral column. So the longus, rectus capitis anterior, rectus capitis lateralis, longus capitis, all these muscles will also be supplied from C1, C2, C3, C4. And you also know that the C3 and the C4 supplies the levator scapulae, scalenus anterior and scalenus medius. So branches from the cervical plexus are cutaneous, which we saw in the posterior triangle mainly, coming out from that nerve point of the sternocleidomastoid. We have the muscular branches, which are supplying the prevertebral group of muscles, the diaphragm, and these strap muscles. Plus, we have these communicating branches, which are communicating with the hypoglossal nerve and supplying the muscles. They also communicate with the accessory and the cervical sympathetic trunk. So this is about the cervical plexus, and the simplest of all the versions of the cervical plexus which I could have drawn is what I've shown. Now let's focus on the nerve of choice. What we have to study now is the Ansa cervicalis. Now the Ansa cervicalis, as we've just seen, is formed by two roots. So it's almost like a mini plexus which is being formed from the cervical plexus, and this mini plexus consists of C1, C2 and C3 fibers. And the C1, C2, C3 fibers together, they form this muscle, this nerve, the Ansa cervicalis, which will supply the strap muscles, which we are going to be seeing. Right? So it is formed by two roots. We saw the superior root and an inferior root. So the superior root consists of fibers which hitchhike with the hypoglossal nerve. And let's draw that the carotid sheath contents behind. So we have the carotids here. Sorry, let me redraw it. Let's draw the carotids first. We have, this is the representative of the common carotid as well as the internal carotid arteries. And let's draw the internal jugular vein. So that आपको location पता होगी जब आप when you're seeing it in the cadaver, but at the same time you need to write the location out here also. So it is present around the carotid sheath, anterior to the carotid sheath or lateral or to the carotid sheath, depending on where the fibers are arising. The C1 fibers come to lie anterior to the carotid sheath in between the common carotid and the internal carotid, depending on what level we are seeing it at. And internal the carotids as well as the internal jugular vein. These fibers are the ones which have hitchhiked with the hypoglossal nerve. Some C1 fibers continue with the hypoglossal nerve. So these are the C1 fibers. The C2 as well as C3 forms the inferior root of the Ansa cervicalis, which is initially lateral to the internal jugular vein and then comes to lie anterior to it and then joins with the superior root. The superior root gives rise to a branch. Now the superior root is giving rise to a branch which is supplying the superior belly of omohyoid. So the superior belly of omohyoid is getting its branch from the superior root. Thereafter, when the Ansa cervicalis has been formed, we get branches to supply the sternothyroid. We get branches to supply the sternothyroid, the sternothyroid, and the inferior belly of omohyoid. Right? The thyrohyoid gets its branch from the C1 fibers. Gets its branch from the C1 fibers which are hitchhiked with the hypoglossal nerve, the thyrohyoid. So this is how the Ansa cervicalis is formed in the neck. This is its location and what are the muscles supplied by it. So you should be able to identify and you have to keep the landmarks, the structures. So the importance of location is that when we are looking at it in the neck, we should look at the structure. So we know that we have to look for it in the vicinity of the carotid sheath. The inferior root is lying lateral to the internal jugular vein, while it then goes on superior to it and then goes on to form join the superior root. Now you can also make out from this diagram that most of the part of it is lying within the carotid triangle. But ये यहाँ पर उन्होंने omohyoids को थोड़ा सा retract किया हुआ है. But you will see that some of it moves out of the carotid triangle and starts peeping into the muscular triangle part. So, but mainly we will say that it is a content which is lying in the carotid triangle over the carotid sheath. So, as I told you, we have to go across boundaries to understand structures, because to complete the strap muscles, I needed to pick up the Ansa cervicalis, which is actually going to should have come in the anterior triangle. So now let's return to King Joffrey. We made him wait enough and we know that the brat doesn't like that. So what really happened? He was fed, not what happened in GOT in our case. What happened was that he was fed something to which he was allergic, as a result of which there was edema in the oral cavity and edema taking place around the vocal cords as well as the laryngeal and the pharyngeal cavities. Because of that intense anaphylactic reaction which took place, the airway got blocked and he was unable to breathe. So his SpO2 decreased to 88. He collapsed. So what do we have to do? We have to clear and we have to bypass this obstructive passage. Now to bypass this obstructed passage which has been created, we have to perform a tracheostomy. Now tracheostomy can be an emergency procedure like one we are going to be doing on this particular gentleman, or it may be a elective procedure, and depending on what it is, the settings and the way it is done differs, but that is something which you need to learn somewhere else, not in anatomy. What in anatomy, how it is pertinent to anatomy is that you need to know. It just tells you that why you need to know the anatomy of the front of the neck very clearly, so that you are able to perform a tracheostomy, which is to be done in order to bypass an obstructed airway or to clean and remove secretions and ensure that there is oxygen delivery taking place to the lungs. So for that, a hole is made in the trachea. Sometimes it may be done, a hole may be made even in the larynx. Then it is called cricothyroidectomy. For tracheostomy, a hole is made in the trachea. So the structures which are present anterior to the trachea or superficial on both sides of the trachea become important. So these were the skin. So after an incision is made in the skin, which is thereafter the platysma is incised. Then the muscles of the strap muscles which come in the fascia after the retraction of the incisions in the fascia. Thereafter the platysma, the strap muscles need to be retracted, and you understand now on the basis of how the nerves are coming on to supply the these muscles from the lateral direction. The muscles should be retracted laterally from the medial towards the lateral side, so that we don't put too much of pressure on these nerves which are coming in. Thereafter, we would reach the thyroid gland or part of the isthmus of the thyroid gland, which may be retracted superiorly or it may be incised, and thereafter the trachea may be reached. During this entire process, we would come across the anterior jugular vein, which would be present just around the platysma. So it would be present with the platysma in the superficial fascia. It is important to stick to the midline because we know there are two anterior jugular veins which are flanking the midline on both this one flanking on both the sides. So it is important to stick to the midline or look for this vein ligated carefully or ligated or retracted and then enter into this area. So all the anatomy of this area should be clear to you in order to be able to perform a tracheostomy when and whenever the need arises. Now let's come on to the remaining parts of the anterior triangle, which are the carotid and the digastric triangle. Now in the infrahyoid region, the superior belly of omohyoid separates the muscular triangle from the carotid triangle. The carotid triangle is bounded by inferiorly by the superior belly of omohyoid, posteriorly by the sternocleidomastoid, and superiorly by the posterior belly of digastric, and running along it from the styloid process to the hyoid bone, the stylohyoid muscle. So we've already seen these muscles. It is important because this is going to be traversed by the branches of the external carotid artery, as well as the common carotid, the internal carotid, and tributaries of the internal jugular vein and branches of the vagus nerve. There are other cranial nerves like the hypoglossal nerve, which is also going to be traversing this particular area. So there are a number of structures which are traversing it, that's why this becomes an important area, especially when we want to know the placement of these structures. However, most of the structures do not remain confined here, but move from here over into the digastric triangle or vice versa. The digastric triangle, which is in the suprahyoid region, separated from the submental triangle by the anterior belly of digastric, is bounded by superiorly the ramus, the lower border of the ramus of the mandible, an imaginary line running from the ramus of the mandible to the mastoid process. Inferiorly, it is bounded posterior-inferiorly by the posterior belly of digastric, and anterior-inferiorly, it is bounded by the anterior belly of digastric. Now, what are the muscles which are going to be forming the floor of these triangles? Now, please remember again that in the floor of these triangles is present the skeletal framework of the larynx and the hyoid bone. So, all the muscles which are going to be attaching to them will be forming the floor of these triangles, right? So, this is the posterior belly of digastric with the stylohyoid, which you can see is splitting around the intermediate tendon of digastric. This would be the imaginary, this I've made as the plane in which the superior belly of omohyoid would be there, and this would be the plane of the sternocleidomastoid. So this area is the carotid triangle, and in the carotid triangle, this is the thyroid cartilage, and you can see this is the oblique line. Now, arising from the oblique line are two muscles which are going to be present in the floor. One is this inferior constrictor muscle of the pharynx. Can you see this muscle? This is a muscle of the pharynx which is arising from the thyroid cartilage and going backwards to form the pharynx, to form the walls of the pharynx. Okay, so we can see a part of it out here. So this is going to be present in the floor of the carotid triangle. And also arising from this inferior constrictor and running towards the hyoid bone, we saw another muscle. That was the thyrohyoid muscle. So the thyrohyoid muscle is also going to be present out here and forming the floor of this particular triangle. Peeping into the triangle superiorly is this middle constrictor, which is arising from the horn of the hyoid, greater horn of the hyoid bone. So this is the middle constrictor. So two constrictor muscles are going to be forming the floor. One is the middle constrictor, the other is the inferior constrictor. There's another superior constrictor above, which we saw once when we were looking at the buccinator. If you remember, very good. Otherwise, we'll do later. So these two constrictor muscles are forming the floor. One is the middle constrictor. Two, majority of the floor is formed by the inferior constrictor as well as the thyrohyoid muscle. And peeping into it also superiorly would be this muscle, which is the hyoglossus muscle. So these muscles form the floor of this particular carotid triangle. And please remember that these are muscles which are wrapping around the pharynx or are somehow getting their attachments to the skeletal framework of the larynx as well as the pharynx. Now come on to this digastric triangle. This is the anterior belly. This is the posterior belly of digastric. Now look at this. One muscle which we've already studied, the mylohyoid muscle. So one muscle which is forming the floor is the mylohyoid muscle, and the other is this muscle which is going from the superior border of the greater horn of the hyoid bone upwards towards the tongue, the hyoglossus. So the hyoglossus was peeping in the carotid triangle, and it is also present. It is also forming the majority of the floor of the digastric triangle along with this mylohyoid muscle. And also the part of the middle constrictor, which is also arising from the greater horn of the hyoid bone, which is behind this posterior belly of digastric, is going to be forming its floor. Now, there's no point in studying these structures which are going to be traversing it separately. So in the next class, I will see, as you can see, they are just moving freely from one triangle to the other. So we will be discussing the branches of the carotid arteries as well as the tributaries of the internal jugular vein, the formation of the internal jugular vein, and then the contents separately we will be looking at of the carotid triangle and the digastric triangle in the next lecture.